Good morning, everyone. Magandang umaga for the Philippines. We are here today with Kim Barzell to learn more about these two very special sessions that we have created for connected and relationship matters. The first talk is for parents and caregivers, which will start on June 27th. It's every other Saturday, entitled Parenting, the Most Important Role in the World. Our second talk, it will be for professionals who work with children. It will start on July 8th, every Wednesdays, for 4 sessions, which is entitled, What Will I Do in the Clinic, Whether Online or in Person, Clinical Reasoning Matters. So before we start talking with Kim, I'd like to introduce her. So with this small preview about these two topics, Kim Barzell, a world-renowned speaker and occupational therapist with over 35 years of experience in sensory processing, neurodiversity, attachment, and trauma-informed practice. Now, I'd like to talk about our professional series. So what will I do in the clinic? So with this series, there's like 4 topics that we would be talking about. And it seems so diverse and different. And so basically, there were questions regarding how are these topics connected?
Love it. You know, one of the models that is inherent in supporting people in becoming their best selves is holistic. Understanding how different, I call them spokes on the bicycle wheel, contribute to our day-to-day function. So how we move, how we process sensory information, how we think, how we engage. These are all parts of our brain, parts of our being that allow us to engage in the world. And I think what happens to many clinicians is we look at behaviors and functions in little boxes, in little categories. And as a neuroscientist, what I know is that they weave together. And this series is about clinical reasoning. What do I do when? And am I actually seeing what I think I'm seeing? There is always multiple choices on the menu in the restaurant of what it is that I might need to be thinking about when I look at what might be standing in the way for this individual patient.
Awesome. So you were speaking about the holistic way. And so in the big picture of things, how does this help our clients in terms of their way of doing things?
Well, I think for me, in a history of my learning, I learned all these different frames of reference. It took me 25 years to learn them. Sensory integration, neurodevelopmental treatment, trauma, and they were all little silos of data. And then what I found was I wasn't actually getting there in appreciating the interaction of these things. So when we talk about, you know, the human, the patient is in the middle, and then we look at all the different ways that the patient is affected. You know, if I have a challenge in the brain, in the way I process information, it's going to impact how I move. And how I move is going to impact how I process information. So it's putting these links together, and it allows clinicians to be faster and more efficient in their capacity to understand their client and transfer their knowledge to their client.
Okay, that sounds very practical, and for sure, in the practice of occupational therapy, very holistic. We really look into the person. So moving from there, so we're talking about all these different spokes in the wheel and all these different interventions that we've practiced all throughout the year. So are we saying that there's going to be strategies and techniques that we can apply right away after this session?
Yes. I think that, again, if you can share with the listener the name of the 4 weeks, and we'll talk about how that comes out.
Sure. So the first one is about a vestibular visual contributions to function.
And that sounds so random, doesn't it? But when you understand from the brain's perspective how the vestibular system, which is all about balance and space and movement, as a neuroscientist, the vestibular system affects every single part of the brain. Cognition, emotion, it impacts attention, it impacts movement, and it impacts regulation. So because it's so involved in everything, it is a piece of our clinical observations and then our strategic input as to how we support an individual client. And the eyes, well, at least 87% of human function is driven by vision. It's such a dominant driver of how we engage in the world that we don't always understand how it's impacting our day-to-day function in relationship to our movement system. So this is relatively hot topic, meaning new and cutting edge. And so it gives clinicians a slightly, exciting hit of new ways to think about children and adults who have neurodiversity and how we might give them outcomes that they can transfer into their day-to-day function at home.
Awesome. Okay, so we talked about also for the second session, proprioception and tactile contributions to function.
Well, and proprioception is also believed, it's a sensory sense of where is my body in space. But increasingly so, we are understanding the impact of proprioception and tactile processing on safety, on regulation, on emotional well-being. It's highly impacted by developmental trauma. And it's also very evident in anxiety. So it's not just about movement, but again, the whole person. How does that person know how to put on their shoes? How does that person be in relationship with other people? I read an article today from the Journal of Social Distancing, which is now 3 weeks old.
Oh, wow.
Yeah. And the entire article, first article, is on touch. And what happens when we can't touch and how it impacts all the neurotransmitters in our brain and the neural networks. It impacts learning, behavior, function, relationship, and body awareness. They're even talking about how it impacts how we eat. Because if I don't get enough input to my body, I may need more or less input in my gut. So these are examples of how these little holistic pieces fit together in our clinical thinking.
Wow, that's definitely cutting edge and very new. So now we're talking about this pandemic. The third topic is the most, I think, impactful for us because we have not had a lot of movement. So biomechanics of movement and function is the third topic.
Well, one of the specialties that I bring to this picture is called neurodevelopmental treatment. And this is understanding how we develop movement, how infants in their typical trajectory of development bring online the muscles when they do. And when kids and adults have problems with moving their bodies, we don't always know how to help those muscles work better. So that's one set of our 4 series here is really specifically looking at how do I look at the biomechanics, the base of support, the alignment, center of mass, weight shifts, and how do I put those pieces into function? Now, that each one of these sessions could be its own workshop. So I don't want to mislead people into thinking that you're going to be a master in any of these topics, but they're invitations to discover more about each piece.
Nice. So we were talking about how babies have to trigger something online. So our fourth topic is about baby intervention as foundation for future function.
Absolutely. You know, early intervention, when the brain is so active in its development, is such a powerful time to be very influential in changing the trajectory of a child's future. And so there is a lot involved in treating babies, looking at babies from a motor perspective, from a sensory perspective. I just wrote a chapter on early intervention in an upcoming textbook, looking at all these different spokes on the wheel in infant development and how that can be such a preventer of future challenges and what therapists can bring to that whole series. Many kids come to us when they're 3 or 4 or 7 or 8. And if we can see these subtleties way back when, then that is an opportunity for things to be different in the future.
Wow, that's definitely bringing everything to a connected and very holistic manner.
And I just want to say, you know, these topics coming together, being so cutting edge, they're also invitations for clinicians who, you know, are already doing what they do to broaden their minds into a little bit of a wider lens. And, you know, so the invitation to take your already existing magnificent skills and just open them up a little bit more.
Thank you for that, Kim. Definitely more information and increasing our reach in terms of our practice is always welcome. So Kim, we're drawing to a close of our preview. Would you like to add anything and invite our guests?
Very much. I have a tremendous love for the Philippines. And so I am excited to be spending some time with you in these 2 beautiful series, and also for families from all across Asia who are interested in exploring this idea of consciousness and parenting. So having been in Asia, worked in Asia for the last 15 years now, it's a part of my love. And I look forward to spending time with each and every one of you.
All right. So thank you so much, Kim, for spending time with us today. Again, the parenting series will start on June 27. And the What Do I Do in the Clinic for the professionals will start on July 8th. So please don't forget to check our Facebook page, Connected Philippines Center for Global Education and Training. So thank you so much, Kim, for spending with us today.
And thank you, Connected, for making this possible.